Depression is a common mental disorder characterized by persistent feelings of sadness, hopelessness, and lack of interest or pleasure in daily activities. Imagine a dark cloud hanging over the person's mind, making it difficult to experience positive emotions. Symptoms may include changes in sleep and appetite, fatigue, difficulty concentrating, and thoughts of self criticism or suicide. These symptoms can profoundly affect a person's quality of life, interfering with their performance at work, in studies, and in interpersonal relationships. Depression can be triggered by various factors, including genetic predisposition, chemical imbalances in the brain, stressful life events, and physical health problems. Treatment for depression typically involves a combination of therapy, such as cognitive behavioral therapy, and antidepressant medications to help alleviate symptoms and promote recovery. Anxiety is a natural body response to perceived threatening or stressful situations. Imagine the person's brain being in a constant state of alertness, as if prepared to deal with imminent danger. Symptoms may include excessive worry, nervousness, muscle tension, difficulty relaxing, and sleep problems. These symptoms can be debilitating and interfere with the person's daily activities, impairing their performance at work, in studies, and in relationships. Anxiety can also manifest physically, causing symptoms such as headaches, gastrointestinal problems, and heart palpitations. Treatment for anxiety typically involves therapy, such as cognitive behavioral therapy, which helps the person identify and modify anxious thought patterns, as well as relaxation techniques and, in some cases, medications to alleviate more severe symptoms. Bipolar disorder is a mental condition characterized by extreme mood swings, ranging from episodes of profound depression to episodes of mania or hypomania. Imagine the person's mood swinging like a pendulum between extremes of sadness and excitement. During depressive episodes, the person may feel extremely sad, hopeless, and low on energy. Conversely, during manic or hypomanic episodes, the person may feel excessively happy, energized, and impulsive. These mood changes can significantly affect the person's daily functioning, including work, relationships, and mental health. Bipolar disorder is a chronic condition, but proper treatment, which typically involves a combination of mood-stabilizing medications and therapy, can help the person manage symptoms and lead a more balanced life. Attention Deficit Hyperactivity Disorder, ADHD, is a neuropsychiatric disorder that affects a person's ability to maintain attention, control impulses, and regulate behavior. Imagine the person's brain functioning differently, making it difficult to focus on specific tasks and control impulses. Key symptoms include restlessness, difficulty paying attention to details, easy distractibility, impulsivity, and difficulty following instructions or completing tasks. These symptoms can significantly interfere with the person's daily life, especially in school, work, and relationships. ADHD can persist into adulthood, affecting both professional and personal life. Treatment typically involves a combination of behavioral therapy, time management strategies, educational support, and sometimes medications to help control symptoms and improve quality of life. Schizophrenia is a severe mental disorder that affects how a person thinks, feels, and behaves. Imagine someone's brain processing information differently, causing a disconnect between thoughts, emotions, and reality. Symptoms include hallucinations, such as hearing voices or seeing things that are not present, delusions, which are false and irrational beliefs, disorganized thinking, and difficulty maintaining attention and focus. These symptoms can significantly interfere with the person's daily life, affecting their personal relationships, work, and self-care. Although the exact cause of schizophrenia is not fully understood, it is known that a combination of genetic, biological, and environmental factors plays a significant role. Treatment typically involves a combination of antipsychotic medications, psychotherapy, and social support to help the person manage symptoms and lead a more balanced life. Borderline personality disorder is a mental condition characterized by emotional instability, tumultuous relationship patterns, and an unstable self-image. Imagine a roller coaster of emotions where people with this disorder can quickly shift from intense feelings of love and devotion to anger and despair. This instability can lead to impulsivity, self-destructive behaviors, and difficulties in maintaining healthy relationships. It's as if the person is constantly struggling to find emotional balance. Additionally, there is often an intense fear of abandonment, leading to desperate efforts to avoid abandonment, even if it means tolerating harmful relationships. Treatment typically involves therapy, where the person can learn to regulate their emotions, improve self-esteem, and develop healthy coping skills to deal with life's challenges. Obsessive compulsive disorder, OCD, is a mental disorder characterized by intrusive and repetitive thoughts, known as obsessions and ritualistic behaviors called compulsions. Imagine the person's mind being stuck in a cycle of worries and repetitive actions. Obsessions can be about themes such as cleanliness, safety, order, or symmetry, and cause significant anxiety. To relieve this anxiety, the person performs compulsions, which are repetitive behaviors such as hand washing, checking doors, or counting things. These compulsive behaviors offer temporary relief, but the anxiety returns, leading to a vicious cycle. OCD can interfere with the person's daily activities and impair their relationships and quality of life. Treatment typically involves cognitive behavioral therapy, where the person learns to challenge their obsessive thoughts and gradually reduce their compulsions. Eating disorders are psychiatric conditions that affect a person's relationship with food and their body. They include anorexia nervosa, bulimia nervosa, binge eating disorder, and other dysfunctional eating patterns. Imagine the person's mind being stuck in a cycle of negative thoughts about food, weight, and body image. In anorexia nervosa, the person severely restricts food intake, leading to significant weight loss and intense fear of gaining weight. In bulimia nervosa, there are episodes of binge eating followed by compensatory behaviors, such as vomiting or excessive exercise. In binge eating disorder, episodes of binge eating occur without compensatory behaviors. Treatment typically involves a multidisciplinary approach, including nutritional therapy, psychotherapy, and sometimes medications, with the aim of restoring a healthy relationship with food and promoting a positive body image. Post-traumatic stress disorder, PTSD, is a mental condition that can occur after a traumatic experience, such as an accident, violence, or war. Imagine the person's brain being stuck in an extreme state of alertness even after the danger has passed. Symptoms may include flashbacks, where the person relives the traumatic event, nightmares, avoidance of situations that remind them of the trauma, and hypervigilance, where the person is constantly alert to potential threats. These symptoms can be debilitating and interfere with the person's daily life, affecting their relationships, work, and overall well-being. Treatment typically involves therapy, such as cognitive behavioral therapy, which helps the person process the trauma and learn strategies to cope with symptoms. Substance use disorder is a condition in which a person struggles to control the use of drugs or alcohol, despite the negative consequences it may entail. Imagine your brain establishing a complicated relationship with a substance. Initially, it may be pleasurable to use it, but over time, your brain adapts and starts to need it to function normally. This can lead to dangerous behaviors, such as driving under the influence or harming personal and professional relationships. The disorder can range from mild to severe, affecting the physical, mental, and emotional health of the individuals involved. Treatment typically involves a multidisciplinary approach, including therapy, medications when necessary, and social support. Like the video, subscribe to the channel, and leave a like on the video.